please tell me why are we celebrating World Polio Day?
The World Polio Day was celebrated on 24th October every year. It was established by Rotary International over a decade ago to commemorate the birth of John Salk, who led the first team to develop a vaccine against poliomyelitis. Use of this inactivated poliovirus vaccine and subsequent widespread use of oral poliovirus developed by Albert Sabin led to the establishment of the Global Polio Eradication Initiative in 1988. Polio is a potentially fatal infectious disease. There is no cure, but there are safe and effective vaccines. Polio can be prevented through immunization. Polio vaccines are given multiple times, almost always protect a child for life.
Okay, now let me ask you some other thing. What is actually polio?
Poliomyelitis, or simply polio, is a highly infectious viral disease that largely affects children under 5 years of age. The virus is transmitted by person to person, spread mainly through fecal-oral route, or less frequently by a common vehicle like contaminated food or water, and multiplies in the intestine, from where it can invade the nervous system and cause paralysis.
Types of polio. There are 3 types of polio. The first type is abortive polio. It is also known as minor illness. It occurs in approximately 4 to 8% of infections. Its diagnosis cannot be made clinically and the recognition only by virus isolation or rising antibody titer. The second type is non-paralytic polio. It occurs in approximately 1% of all infections. The disease lasts 2 to 10 days and the recovery is rapid. The third type is paralytic polio. It occurs in less than 1% of all infections. In this type, the virus invades central nervous system and causes varying degrees of diseases.
Symptoms are seen in 3 phases: paralytic, non-paralytic and post-polio. Under paralytic, losses of reflexes, muscle pain, sudden paralysis. Under non-paralytic, fever, sore throat, headache, vomiting, fatigue and meningitis. Under post-polio, muscle pain, trouble in breathing, sleep apnea and joint weakness.
Okay, so that's the thing. How can we prevent this? Is there any vaccination for this?
Yes, there are preventive methods. There are 2 vaccines available. The one is inactivated polio vaccine and the other is oral polio vaccine. Inactivated polio vaccine is administered intramuscularly. The doses are: the first 3 doses are given at intervals of 1 to 2 months. 4th dose is given at 6 to 12 months interval after the 3rd dose. The first dose is usually given when the infant is 6 weeks old, and we can give additional dose at every 5 years until the age of 18. And also there are several advantages, that is, it is not contain any living virus and it is safe to administer. And also the person with immune deficiency disease can also use this. And during pregnancy, those people also can use this vaccine. And next I'm going to tell about the oral polio vaccine. It is given orally, as we all know. And the primary course, it is given 3 doses of oral polio vaccine at 1 month interval. First dose when infant is 6 weeks old. It is very important to complete this vaccine at infant age, and it's before 6 months of age. That is because the most polio cases occur between age 6 months and 3 years. And also one booster dose of OPV is recommended 12 to 18 months later.